Welcome to the Fed to Fed podcast, where we dive into the dynamic world of government technology. In this podcast series, we'll be joined by current and former federal leaders and industry trailblazers who are at the forefront of innovation. Here, we speak openly and honestly about the challenges and opportunities facing the federal government and the Department of Defense and its partners in the modern age, driving innovation and the incredible capabilities of technology along the way. Whether you're a federal leader, a tech industry professional, or simply fascinated by IT modernization, just like us, this podcast is for you. And we're so happy to have you tuning in. All right, fantastic. Kate and Deanna, thank you so much for joining us today.
Thank you for having us. We're really excited to get a chance to talk about helping patients.
Kate, why don't we kick it off? Tell us a little bit about yourself. Tell us more about Cala. And then, Deanna, you'll do the same.
Perfect. Well, thank you so much for Susan for having us here today. So I am our founder here at Cala Health. I'm a scientist and engineer by training, and really was just incredibly inspired by the unmet need that patients face daily in living with hand tremors, and saw a really unique opportunity to connect some of the emerging neuroscience with really dramatic advancements in technology over these past decades, and developing a new class of therapy for patients that we're very excited to tell you about today.
Fantastic. Thanks so much, Kate. So, Deanna, tell us a little bit more about yourself and the direction that you're focused on.
Yes, absolutely. So I feel very grateful that in my lifetime and career, I've been able to spend over 20 years working in the healthcare space. And in particular, I spent a significant amount of time working with movement disorder patients as well as physicians. And so I was extremely excited to get the opportunity to join Cala Health a little bit over 4 years ago when I heard about a unique way to help patients, especially when there is such a great need out there, and really excited and energized by the team at Cala Health, who is focused on really helping patients, and in particular where we are today, patients with essential tremor.
Fantastic. Thank you so much, Deanna. Tell us a little bit more about essential tremor. How prevalent is it? How does Cala TAPS therapy work?
Absolutely. So I think most people don't really see the scale of patients with essential tremor. There are more than 7 million patients within the United States with essential tremor. And its characteristic is really hand tremor. So you will find patients that have great difficulty being able to do things that we find very simple to do. So just with getting up in the morning, being able to brush your teeth, get your hand through the armhole of your jacket or sweater. These are things that are really difficult for patients with essential tremor. There are basics around eating, being able to bring a spoon to your mouth, being able to bring your cup of coffee up to your mouth. And we get to hear from our patients. One just told us the other week about how excited he was that he was finally able to drink a full cup of coffee and that he could fully feed himself and do that independently, where he always needed help before. And so, patients with essential tremor, what they find is a very difficult journey. When we look at the treatment options that are available for them, they typically start out on pharmacotherapy, on medications, and it works well initially. However, a lot of those medications are non-specific to essential tremor. They're typically used as beta blockers or medications for seizures. And so the patients have a very difficult time with either contraindications or being unable to handle those side effects. And what really happens is, because essential tremor is a neurodegenerative disease and it gets worse and worse over time, people will begin on medications and they will start to take them and it works great initially. But as their tremor worsens, they have to bring up the dosing of those medications. And over time, what they find is the side effects are worse than the tremor itself. They're unable to handle them. And then the only other treatment options that they have are going to more invasive yet very effective therapies such as focused ultrasound or deep brain stimulation. And so that leaves a huge set of patients with this in between, being not fully treated with their tremor, and the only other option being able to go to something that is either surgical or invasive.
Thank you so much for sharing that. So, Kate, tell us a little bit more about this technology. Why was the Cala KIQ system developed, and what specific need does it address?
I think Kate
Sure.
would be able to
Sure, I'll take on answering
take
that.
that
So,
one.
Yeah.
it was really developed. I mean, as Deanna was noting, it was, first and foremost, we are here for the patients, and just realizing the suffering, the struggle, that can be alleviated with technology and with new science. And that was really sort of, I'd say, was and is and will continue to be our driving North Star. What we then really layered into that was some understanding about new ways that we could target the mechanism of the tremor. So, our therapy is a prescription device. It's worn on the wrist. And the device actually uses motion sensors to measure each patient's unique tremor signature and then uses that information to individualize the stimulation pattern that will treat that individual patient's tremor. So every patient's tremor is very unique. For example, some patients tend to have a slow tremor, while other patients will have a very fast tremor. And those different patterns really need different stimulation to treat them. So the development behind this was really around understanding the needs of the patients, looking at how we could actually deliver stimulation to the nerves at the wrist, and then actually rely on the body, rely on the peripheral nerves to carry those signals up to the brain. So the therapy counteracts the tremor by dephasing the neurons that are responsible in the brain for the misfiring that leads to a tremor. So it was really that convergence of understanding of the mechanism behind tremor, these two insights around how we could both use the targeting in the peripheral nervous system, that we could have a device that is worn, on the same place in the wrist as a wristwatch. It would be very discreet for patients. We could use the way that the nerves actually send information to the brain, much like if you stub your toe or, touch, you hold hands with a loved one. Our sensory nerves are really built to carry information to the brain, as well as how to use, the technology itself, the miniaturization of connected electronics, enabled to be able to do that. So really, that was what led to the development of this, was realizing where we have this, enormous unmet patient need, and where we could converge that with the science and technology.
Wow, that is so cool. Kate, tell us more about the clinical validation that exists to support the use of this stimulation therapy.
So, CalTAPS therapy is the most researched wearable for essential tremor. We have over 2,000 patients studied. These studies have included multiple randomized clinical trials. We've run comparisons both to sham as well as to standard of care, so typical to standard medical care. And what we've shown there is that with each therapy sessions, patients experience a boost of tremor relief both during as well as in the hours after use. Very excitingly, we also there was just a publication on showing continued daily use of CalTAPS therapy, that patients who use on a frequent basis are also seeing gradual improvement in their underlying tremor. Likewise, what's very exciting is for patients who are using therapy many times daily, they're able to repeatedly run the stimulation and extend that relief throughout their day. And so we just see this as a very sort of exciting evolution in that evidence. We've also run many longitudinal studies. We've shown that patients can use therapy without habituation, so continuing to get benefit over multiple years. We continue to publish, importantly, on our real world evidence. We've published evidence now out beyond 3 years, and have patients who have now used therapy beyond 5 years. And so we'll be bringing that forward for publications as well. We're fortunate to have terrific academic collaborators and have been publishing on mechanism of action for many years as well. We've published with the Mayo Clinic. Cala Health itself is a spinout from Stanford University, where I was doing postdoctoral research and participated there in the biodesign program, and really recognize, the enormous opportunity for treating these patients and translating of that science. of course, just to, take this home as well, really, when you look at the studies, I think, the reason we come into work every day to do what we do is truly restoring dignity for patients. And if we look at the case series as well that we continue to share, one that particularly comes to mind on that is a case series that was recently presented by a neurologist from a VA in Hines, Illinois.
Mhm.
And what she was sharing was stories from a few of the patients that she had prescribed therapy. Importantly, not only did all of the patients in that study benefit from the therapy in areas like all of them, for example, had reported challenges with eating that were largely addressed by the therapy. What especially struck me was one of the patients that she shared that had a gentleman who had a fairly remarkable 96% improvement in his tremor. And she shared that not only had he recovered his ability to use a mouse, he had entered the civilian workforce and was having troubles using a mouse and was able to, work more effectively in controlling his hand tremor. And he was also able to get back to doing one of his passions, which was building mini Lego sets. And she shared this image of an incredible cherry blossom tree. I think they're sort of the Washington, D.C. cherry blossoms. And, that is what makes the work such an honor is, really seeing those impacts on patients. And I'd really emphasize there, it's beyond the relief to the tremor itself, to the eating, drinking, and writing. As Deanna was mentioning, tremor also has an enormous impact on mental health. Tremor patients, have double the rates of depression and anxiety. Obviously, this is of particular consideration when it comes to veterans who may have additional risk factors associated with mental health as well. And I think this is one of the reasons that in our studies, we see benefit not only in the tremor itself, but also in the global health indicators. Because, if you take someone who's going from being more socially isolated, is embarrassed about eating out with friends, for example, and you actually bring them back into community and into activity, they're really doing better.
Wow, that's so fantastic. Deanna, tell us more about how Cala device is reimbursed. How is it used at the VA? And how is it available to others?
Yeah, absolutely. And one of our passions at Cala is making sure that every patient that wants and needs the therapy gets access to it.
Mhm.
And so that really has been something that the team has worked on significantly over the years. And starting with the VA, because we know that there is this prevalence within the VA, and we want to ensure that people with tremor get the ability to get it treated. So our therapy today actually has an indication for both essential tremor and for Parkinson's disease, and veterans within the VA that have eligible VA access are able to get full coverage for the therapy. So they would go in and see their VA physician just as normal, and if that physician deems that this is the best appropriate therapy for them, they can get that fully covered. That is really, really important to us. Coming from a family where I have veterans in my life, I know how important it is. And same thing as we were talking about with such a high prevalence, if you haven't noticed someone with essential tremor, you will. You just start to look for it and you will see that it is everywhere. And it is the criticality of allowing people to basically participate in their lives. That is very important. So, with that significant amount of clinical data that Kate was talking about, we've utilized that data to be able to provide access for patients that are of Medicare age. So those that have Medicare and also those that have Medicare Advantage plans are able to get coverage. And we continue to advocate for patients in the commercial insurance space as well. One of the key things that we talk about as a team at Cala every single day is we bring ourselves to work to be able to serve patients. And our goal, again, is to make sure that anybody that needs the therapy should be able to get access to it in a meaningful way, because we are lucky enough to see what a difference that makes in our patients' lives.
I love it. Kate, last words?
Just thank you so much for everything we all do as a community to improve patients' lives. Really appreciate the opportunity to do this podcast with you today.
It's a pleasure to have both of you here, and thank you so much for sharing more about the incredible work that you're doing and connecting the importance of technology to the real world of what needs to be done.
We love it. Thank you.
This concludes today's episode of the Fed to Fed podcast. If you enjoyed this episode, please don't forget to subscribe, rate, and leave a review. Your feedback helps us continue bringing you thought-provoking conversations with the brightest minds in government technology. Stay tuned for our next episode, where we will continue to explore opportunities to harness the power of technology and explore what's next in developing a more innovative and efficient government. Until then, this is the Fed to Fed podcast by GovTech Connects. Thank you for joining us.